Hello, welcome back to my next video. This is on anesthesia. So, what is anesthesia? Anesthesia means to sedate a patient or to reduce the consciousness or to reduce the awareness of a patient during the surgery. This is called the anesthesia. So, anesthesia or anesthesia, the two type of pronunciation. In the form of Greek, this is means without sensation. It means to when we provide anesthesia or when we provide an anesthetic agent to a patient, the patient sensation or patient consciousness is totally reduced or mainly controlled or temporary loss of sensation or awareness that is induced for medical purpose. Any type of surgery like the minor surgery or major surgery or any type of investigations like sigmoidoscopy or colonoscopy, it may include some or all analgesia to prevent or to prevention of any type of pain or relief from pain or paralysis for muscle relaxation and amnesia for loss of memory. Okay, and unconsciousness also. A patient under the effect of anesthetic drug is referred to as being anesthetized. So, this is the mainly anesthesia. So, who provide the anesthesia? An anesthetic team included a surgeon, nurse, anesthetic doctor, or the patient. This is mainly called the anesthesia. Then the classification. At first, the general anesthesia, it means the overall consciousness is reduced, and the regional anesthesia, in the regional and local anesthesia, this is two type of two anesthesia, which is mainly reduced sensation or loss of sensation is a typical or a pre-planned region or a proper region. This is called the regional anesthesia, and the monitored anesthesia care and moderate sedation. So, what is mainly general anesthesia? The loss of sensation with loss of consciousness. Combination of hypnosis also happen, or analgesia. It means hypnosis means the sedation, analgesia means to prevent the pain or to relieve from the pain, mainly the ibuprofen, these types of drugs. Amnesia, it means loss of memory. The skeletal muscle relaxant is mainly used. Usually involve use of inhalation agent. It means to promote the general anesthesia, we mainly give inhalation agent. Okay. So then the elimination of cough, gagging, vomiting, and SNS responsiveness. Responsiveness means sympathetic nervous system responsiveness. Then the requires advanced airway management. The ET tube or the bag mask ventilation. This is mainly required. In the local anesthesia, loss of sensation, but the loss of consciousness cannot happen. Induced topically or via infiltration or intracutaneously or subcutaneously. Topical application also happen. Then the regional anesthesia. In the regional anesthesia, the loss of sensation mainly happen and to a region of the body or a particular portion of the body without loss of consciousness. Involve blocking of specific nerve or a group of nerve by local anesthetics. Then includes the spinal anesthesia, caudal, epidural anesthesia, etc. Then the monitored anesthesia care. So what is the monitored anesthesia care? It is also similar to the general anesthesia. The loss of consciousness also happen, and the sedative, anxiolytic, analgesic mainly used, but does not include inhalation agent. Patient is mainly responsive and breathe without assisting. The no requirement of any type of ET tube or bag mask ventilation. So not expected to induce level of sedation, and minor therapeutic for the minor therapeutic procedure, this moderate sedation mainly given. Then the general anesthesia. In the general anesthesia, it is a technique of choice for patient who are having surgical procedure that has significant duration. It means major or minor surgical procedure which needed a proper duration or skeletal muscle relaxation, require uncomfortable operative positions like the prone position or Trendelenburg positions, or any type of heart-lung machines, use of heart-lungs machine because of location of the incision site or require control of ventilations. This is the general anesthesia. Then the phases of general anesthesia. There are 4 phases. This is pre-induction phase, induction phase, maintenance phase, and emergence phase. So this is the phases of anesthesia. I elaborately discuss about this. Then at first, the stages of analgesia, it means pre-induction phase. Here, we mainly provide the analgesic drug to control or to prevent pain during the procedure or during the surgery. Here, the respiration is also normal and ocular movement, voluntary control, and pupillary size is also normal. Eye reflex, muscle tone, respiration, all is mainly normal in the stage of analgesia. Then the induction phase, it means we provide a anesthetic drug to a patient. This is the at first the stage of anesthetic. It means the induction phase or stage of excitement. Here the respiration mainly normal but quite disturbed, and the pupillary size is mainly dilated, and eye reflexes lid is mainly low, and muscle tone is strain struggle. Then the surgical anesthesia, it means maintenance phase. In the maintenance phase, the respiration also shallow, so it needed a mechanical ventilations or any type of ventilations. So ocular movement, no eye motion. So pupillary reaction is constricted, but slowly it may be normal to dilated. Then eye reflexes, pupillary light is also reduced, and stage 4 is mainly stage 4. You can see here, this is a emergence phase. In the emergence phase, if we cannot reverse back a patient from anesthetic period to a normal period, then the imminent death may be happen. Respiration also don't the person cannot take proper breath. This is the apnea, and pupil also relaxed, and the muscle tone flaccid, no eye reflexes, and no respirations. Then the pre-induction phase. So what is the pre-induction phase? So the stage 1, also known as the pre-induction phase. Here it is a period between the administration of the induction agent. It means here we mainly provide a patient an analgesic agent with a induction agent for the loss of consciousness. Okay, during this stage the patient progresses from analgesia without amnesia to analgesia with amnesia. At first we provide the analgesic agent, then the anti-vomiting agent, then we provide the any type of general anesthesia or local anesthetic agent. That's why the patient is going through the amnesic period. Then the role of anesthesiologist determine the final anesthetic care plan, insert and monitor IV access. If any type of drug is used during the induction period or maintenance phase, then insert and monitor the IV access and confirm antibiotic prophylaxis for the prevention of any type of infections, and administer drug to reduce the anxiety, aspiration prophylaxis, etc. Then the role of the perioperative nurse. In here, mainly the complete pre-operative assessment is needed and check and confirm signs of informed consent. Informed consent is informed consent is the main consent during this period. Then the induction phase. In the induction phase, it is also known as the excitement phase, and here we provide, or a anesthesiologist provide a anesthetic agent, any type of propofol or regional anesthesia, to provide a loss of consciousness or marked by excited or delirious activities. During this stage, patient respirations and heart rate become irregular, may be tachycardia. In addition to, there may be a uncontrolled movement of the limbs, or vomiting may be happen. So to reduce the vomiting, we mainly provide a Rantac or the 5-HT3 antagonist, and suspensions of breathing and pupillary dilatation. So in the general anesthesia, there is should be needed artificial airway or a mechanical ventilations. Then the role of anesthesiologist: administer appropriate drug and secure airway, and position the patient properly according to the surgical procedure. And role of perioperative nurse is the assist with applications of monitor and assist with airway management. Then the maintenance phase. Here, this phase is also known as the surgical anesthesia period. Here, mainly the skeletal muscle relax, eye rolls, and become fixed. After giving any type of anesthesia, the patient is undergone into the maintenance phase, where the surgery mainly happened. The patient remain unconscious, and corneal and laryngeal reflexes are lost. Pupil are dilated. Light reflex also lost, and intercostal paralysis and shallow abdominal respiration occur. It means the abdominal respiration also occur. And role of anesthesiologist may monitor the patient's physiological status and administer medications if needed, and titrated fluid. Any type of colloid or crystalloid is needed, then give in this period. Then the emergence phase. Emergence phase is mainly where the surgical procedure is completed. After completion the surgical procedure, the patient is prepared to bring in a unconscious period, and here in a consciousness period. In here, if after the completion of the surgical procedure or after a specific time, if the patient cannot bring into the consciousness period, then the patient's coma or the spinal death may be occur. If overdose occur when too much anesthetic medications is given, then the brain stem or medullary depressions can be happen, and resulting in a cessation of respiration and potential cardiovascular collapse may be happen. And in this stage, the airway support and cardiovascular support should be remain intact. And role of anesthesiologist: give reverse residual neuromuscular blocking agent. And in this emergence phase, where which medication we give in the induction phase and maintenance phase, emergence phase is totally opposite, like this. Reversal agent should be given, an anticholinergic opioid antagonist, like this antagonist agent should be given in this phase. And remove the airway assistant device if a patient's spontaneous breathing is happen. Then the assess pain and assess for return of all protective reflexes. Then the drugs. In the pre-induction phase, the benzodiazepine should be used. Benzodiazepine, opioid, any type of antibiotics like to prevention of infections, aspiration prophylaxis to prevent aspirations, mainly the anti-vomiting agent or the H2 receptor blocker, 5-HT3 receptor antagonist, or the gastric motility agent, anticholinergic agent. This should be given. And induction phase. In the induction phase, the barbiturate, benzodiazepine, opioids, hypnotic, volatile agent, opioid for to relieve the pain. And in the maintenance phase, the benzodiazepine, opioid, barbiturate, hypnotics, volatile gases like the nitric oxide or nitrous oxide should be given to a patient. And in the emergence phase, the reversal agent. All of these reversal agent or opposite agent: anticholinergic, opioid antagonist, benzodiazepine antagonist, supplemental opioid to relieve the pain, and antiemetic should be given. Then the classifications of general anesthesia. So what is general anesthesia? Where a total, where a level of consciousness is totally lost. This is called the general anesthesia. So here the two type of mainly the drug is used, the inhalational and parenteral. In the inhalational, you can see here the volatile liquid halothane, isoflurane, desflurane. It is mainly a volatile liquid. And gas is the nitrous oxide. Through nebulizations or through the oxygen cannula, it should be provided into the patient's airway channel, and After giving this, the patient is undergone into the unconsciousness period. And then in the parenteral, you can see here the inducing drug. The inducing drug is the propofol, etomidate, thiopental, and the slow acting drug is the benzodiazepine, ketamine, opioid. And for the general anesthesia, mainly the combination drug is the propofol with nitrous oxide. It is the mainly the common combinations. Then the drug therapy. So barbiturate. The group of the drug is the barbiturate. An example is thiopental, methotrexate, and its advantage is the rapid inductions of duration and disadvantage. So if we give the extra amount of barbiturate, maybe myocardial depressions happen, hypotension, respiratory depressions maybe happen. And in the nursing intervention, you can see here, it is a minimal post-operative effect. Mainly the side effect is totally minimal, and the post-operative nausea also may be increased due to the barbiturate toxicity. And the non-barbiturate agent is the etomide, and it produces the little changes in the cardiovascular dynamic and only minor respiratory depressions. In the patients with asthma or COPD, this etomide cannot use. And disadvantage is the myoclonia, nausea, vomiting, hiccups, adrenocortical inhibitions. And nursing intervention, nurse should observe for transient skeletal muscle movement. If any type of irregular muscle movement may be happen, so inform the doctor. And propofol. Propofol mainly used for the short outpatient procedure like the colonoscopy or sigmoidoscopy, and rapid onset of actions is and metabolic clearance. It mainly totally metabolized and excrete through the urine. And its disadvantage is the bradycardia, dysrhythmia, hypotension, apnea. And nursing intervention, nurses should monitor the postoperative hypotension or bradycardia if happen or not, or check the serum triglyceride for 24 hours. And then the drug therapy is the inhalational agent and the volatile liquid, the isoflurane, desflurane, sevoflurane, and halothane. And it all causes the skeletal muscle relaxation. And isoflurane does not increases the ventricular irritability, and desflurane is the has the fastest onset and the emergence. And sevoflurane rapid acting, predictable effect on the cardio and respiratory system. And halothane has the bronchodilation effect and non-irritating to the respiratory tract, and it can be used in the COPD patient. And in isoflurane, desflurane, it is mainly causes the myocardial depressions or emergence delirium. And in the halothane mainly causes the ventricular excitability or hepatotoxicity, and sevoflurane may be caused the any type of seizure or tremor. And nursing interventions is the assess or treat patient during early anesthesia recovery and assess any type of adverse reactions happened or not. Then the gaseous agent is the nitrous oxide. This is mainly potentiate volatile agent, speeding the inductions and reduce the total dose and side effect. And disadvantages is the it is mainly a weak anesthetic agent and administered with O2 to prevent the hypoxemia. And nursing interventions is the avoid the patients with bone marrow depressions. And dissociative anesthesia is the ketamine. It is mainly administered through the IV and IM, and it is potent with analgesic with amnesic. Two effects mainly happen here. And disadvantages is the hallucinations or increased intracranial or intraocular pressure. And nurses should provide a calm and quiet environment during the post-op period. And local anesthesia is mainly where the surgery is happened and which locations the surgery is mainly happened. So this space or this region we should provide the local anesthesia. So without the total unconsciousness or without the total amnesia, the local or the region is anesthetized. Okay, so the mode of action is the local anesthetic are weak bases and partly ionized and penetrate the nerve membrane and enter into the actions and reionized. and this local anesthetic gains access to its receptors, and after accessing the receptor it blocks the voltage flash channel, okay, sodium channel, and binds with the substrated agent or the inactivated state. Then the sodium ion entry is prevented and prevent generations of action potential and results in local anesthesia. Then the local anesthetic is rapidly metabolized by plasma cholinesterase, and it is administered through the direct injections at the surgical site or the topically or nebulizations. And spinal anesthesia or epidural anesthesia, it is involved. It is also one type of regional anesthesia, and this mainly involve injections of the cerebros into the cerebrospinal fluid. Okay, local anesthetic agent we should introduce into the cerebrospinal fluid in the subarachnoid space, usually below the L2, L3, L4, L5 here. And these things is mainly in which surgery, the prosthetic surgery or the seizure, mainly this surgery, this spinal anesthesia is needed. And adverse effect is the tremor, restlessness, headache, drowsiness, confusion, convulsion, bradycardia, hypotension. So this is all about my topic. So if you like this video, please do like and share, and if you have any type of doubt, so leave a comment. Thank you.